Hello. Welcome back. I hope we didn't lose anyone over the break.
We did not.
We did not. We're still with us. Well, that is great. Thank you very much for sticking with us. I know it's been a couple of long mornings going over these surveys, and sometimes a bit tedious to go over things question by question. But we do want to cover them this way in case you have questions now for us, or that you, after you've heard the training, if you have questions later. We're here to answer them. We understand that there are a lot of questions coming through about the SIPC status and the viewing animals, and that's a challenge. So we're going to try and address those questions and ways to complete surveys but protecting the producers from having their animals seen and the threat of, or the concern that they might have, if they have a foreign animal disease in particular, and there might need to be regulatory actions. We really try to separate ourselves from that ever happening. So moving into Section C, which is the grower finisher age pigs. We start with a definition of these pigs. They are weaned market hogs weighing approximately 60 or more pounds. And we state that they could be housed in either a grower finisher unit or a wean to finish unit or phase, however the producer defines it. We've used this definition of 60 or more pounds for other studies, and so although the producer might have other definitions, we should stick with the definition of 60 or more pounds. And so we asked the question of the 6-month period from July 1st to December 31st, how many pigs were marketed. Now this is not entering the site, but this is how many pigs were marketed from this site. And then we asked, to get a mortality figure on this, we asked how many died between July 1st and December 31st of 2016. And we just note the difference there, that this is not an entry question, and that it's how many were marketed. So for those pigs that were not in a wean to finish unit, again, that these were, this is a separation from above, what was the average age of the pigs when they entered the grower finisher phase? And I believe we had a question about whether this should be in days or weeks, and we will accept either, but we do want you to note whether it's days or weeks. So if the producer says that it is a certain number of days, please write down the units for us. This was a bit of an oversight on our part again. And again, the average age of the pigs when they left the grower finisher phase. Very good. So now we go into the antibiotic use. Question 4 is, were any antibiotics given by water for any reason to grower finisher age pigs marketed between July 1st and December 31st? And if the answer to that question is no, then you can skip to question 6. Okay, moving on. We'll then look at our antimicrobials in water, the primary reason codes for their use. And again, here we're referring to the antimicrobial, the antibiotic list of for use in swine water. And again, this is on the back of the questionnaire, page 18. The antibiotic list for use in swine water is the table very back of the questionnaire. The primary reason codes are those that we went over again before, and there are 6 of those here. Note that with water use, there is not a growth promotion or feed efficiency or production use. These are all used for preventing, controlling, or treating bacterial diseases. And then number 6 is for other disease prevention, control, or treatment. And we would want you to write in the disease there. That's an open-ended question. I suppose if the producer wants to report to you that they used it for growth promotion, you are free to write that into the questionnaire and make a note of that. It's not something that we would be reporting out, but we would be interested. If someone is using that for growth promotion, it would be off-label. We don't certainly recommend it. We won't report it, but it is something you could talk with them about. Education is an important component of what we're doing, and if you could say that is an extra label drug use, that would be something you could help them with, and look at the label and go over that with them. Question 5 is, excuse me, the table that actually collects the data on the antibiotics given in water with the primary reason code, the percent of grower-finisher pigs from Section C, Question 1, that received this product during 2016. And then that would be, again, the 6-month period, the last half of 2016. And all of these are written to all these tables that say during 2016. We are reiterating that is the last half. We just didn't have room for all of the text in here that we needed to. And the average days in water per group. Okay, moving on to antibiotics or antimicrobials in feed. We also asked in question 6, I believe, who contributed to completing this table. So if you would complete question 6 the same way you did in the others, check all that apply on those items. And then question 7 then would be the leader question for the screener question, as we call it, for antibiotics given in feed to grower-finisher age pigs. And if question 7 is no, then the antimicrobial section for grower-finisher pigs is complete, and you would go on to section D. But if question 7 is yes, then we go on to antimicrobial use in feed. And our primary reason codes for question 8. Again, we have the prevention, control, or treatment of bacterial diseases. I won't read them again. I know you've heard them quite a few times. But note that primary reason code 5 for antibiotics in feed is actually for growth promotion. Increased rate of gain in feed efficiency, so antibiotics in feed were allowed. They were legal. They were an unlabeled drug use in 2016. So if people are concerned about reporting that because it's an extra label use, as long as it's labeled for growth promotion, you certainly can report that. For Table 8. This again has columns for the primary reason code and the percent of the grower-finisher pigs from the Section C, Question 1 that received the product during the last half of 2016. The average age of pigs, and here we cite in days, when the product was first added to feed, and the total days in feed per group. So again, the duration question might come up, and we have the same caveats as I mentioned earlier, that we protect the data, that we're looking at this in the aggregate, that we are not reporting this out to the FDA as a regulatory action or anything like that, and that they are free to not answer that question, but we do appreciate when they do provide us the information because it is important data for us. Okay, that after question 9, again, the person who contributed to answering question 8, once that's complete, we have completed the antimicrobial use questions with this survey. Does anyone have any questions here on antimicrobial use, the data collection piece? If you have questions, say for Eric, he's worked with these data before. He might be able to give you something from his experience. Please feel free to jump in here with any questions.
I'm seeing no questions at this time.
Thank you. Okay. So on Section D is the stewardship section, and just as with the beef survey data, we are looking to see who is making decisions about use of antibiotics, and that is who decides which ones, who decides how long, what antibiotic to use, where they get their sources of information from, and so forth. So that's what this section really covers, is how the decision making is made on swine sites. And so we have a note here on the person who is responding to these questions that it's preferable for the producer or the site manager to answer the questions in this section, and that the company's veterinarian or site veterinarian should not be needed for this section. So if you do have a few people who are responding, this is some guidance on who would be the best or the most comfortable answering these questions. So for the last 6 months of 2016, were any nursery or grower finisher age pigs given any antibiotics in water? And this is kind of a data check question. This is the kind of thing, I'm trying to remember exactly which questions are related in the past, in the previous sections, but this is a data check so that if they answered yes to giving these antibiotics in water earlier, they should answer yes to this. Then we go on to question 1. If they say there were no antibiotics given in water to nursery or grower finisher age pigs, you can go on to question 5. Question 2 goes into who decided when antibiotics were to be used in water, and we allow you to check all that apply in the group of the items below. And note that if a veterinarian provided a protocol to be followed for the operation, select one of the veterinarian options. And there are 3 or 4 of them that are veterinarians, and other ones are the owners of the operation, farm managers, and nutritionists, and feed mill type folks. So those are options for who decided when antibiotics should be used in water. The same thing applies for question 3, who decided which antibiotics were to be used in water. The same caveats apply. If the veterinarian provided a protocol, select one of the veterinarian options on the list. And there are 3 veterinarian options. Moving on to question 4, we are asking here for recording of information. And in this case, we're asking how frequently was the information recorded, whether via handwritten records or records entered into a computer. There's only a column for, there's only 1 X per row allowed in by choosing a column, and so we're not actually looking for the date to be written in. We're just looking to learn if they have actually never recorded a date, sometimes or always, and then whether or not they recorded a date for antibiotic use ending. This is probably going to be familiar to them as the VFDs and the other uses of antimicrobials going forward. There are going to be much more rigorous requirements for recording data. You'll see those starting after 2017. And so this might be on their mind, but we do want to know what the actual record keeping was in 2016 before the 2017 changes went into effect. We also asked whether or not they recorded the antibiotics that were used and the withdrawal period. So again, this is about recording the information, not about actually recording those actual dates or the antibiotics. It's how they recorded the information on those. So now we do the same process for antibiotics used in feed for that last 6-month period where any nursery or grower finisher pigs administered antibiotics in feed. If the answer to this is no, you can skip to question 10, and we ask the same questions. These are a bit repetitive, but by now they'll be familiar to you. Who decided when antibiotics were used in feed? If there's a veterinarian involved in the decision-making process, select one of the veterinarian options below. Otherwise, there are other options for who decided when, and then we ask on question 7, who decided which antibiotics to be used in feed. And again, it's the same list as before. Choose a veterinarian from the list of those 3 or 4 that are veterinary related. And then question 8 is how frequently the information was recorded for antibiotics used in feed. And again, we're not looking for the actual dates. We're looking to see how often the information was recorded, because we'll follow the same kind of questions in maybe 2 years. If we, from now, we repeat the same survey, we want to be looking to see if recording had changed over the time period. Okay, moving on to question 9. This is probably something that might take a little bit more study on your part if you're not used to the FDA language around medicated feeds and articles. The question is regarding whether the producer obtained medicated feed to be fed to pigs on the site by any of these methods. And so for 9A, whether the company supplied and delivered the feed to the site, whether for B, they received their medicated feeds from an off-site, privately owned or cooperatively owned feed mill that then delivered the feed with antibiotics already mixed in. And then 9C and D refer to these type A, B, and C medicated articles and feeds. So for 9C, the type A medicated article is the most concentrated ingredient. And you see on the right-hand side, this is never fed directly to animals without mixing. This is the full concentration of the medicated article, but it's used to make a type B or type C medicated feed. And so we're asking if the article was delivered or brought to this site or operation to be mixed into feed on site. And then for 9D, we're asking if type B or C medicated feeds were delivered or brought to the site to be fed or mixed in a ration on site. And we have definitions for type B medicated feed. Type B medicated feed is never fed directly to animals without further mixing, so that's similar to type A. It's not as concentrated because it's a feed, not an article, but it's not fed directly. It's used to make another type B or a type C medicated feed. And type C medicated feed is the least concentrated, and it can be fed without further mixing. So for those of you who would like further information on the types of medicated articles, medicated feeds and articles, I'm going to look real quick and see what page this is on in the manual. We do have some references to the FDA site, both in the swine section and in the beef section. Right, so we're on, in the manual we are on page 41, and on page 42 are further definitions of the medicated articles and the type B and C medicated feeds. So I think most producers will understand what those types are, and then they should be labeled on the whatever is produced or whatever is delivered to the farm. There should be a label that that says what type of article or feed it is. Okay, I'm going to pause here for a second and see if there are any questions.
We did get a written question. It's not specifically for this section, but just can we go ahead and go over it?
Yes, please.
So if you could just clarify, Kathy, if it's a wean to finish operation, They're going to answer the questions for both sections B and C. If it's a nursery only, they're only doing B, and finisher only would be only C, section C.
We did separate those. Eric, do you have your questionnaire?
Correct to me.
Yeah, it does sound correct to me too. So you're talking about section B, the full section B is nursery age pigs in a nursery or wean to finish unit. Is that the question? Would you
So just to clarify, if it is a wean to finish operation, they would answer questions for both sections B and C. Yes.
Yep.
Nursery only, answer section B.
Yes.
Yes.
That's right.
Finisher only, section C.
Yes. But
Yes.
wean to finish B and C.
Yes.
Yes.
Okay. Thank
Right.
you.
There has been a challenge of designing these surveys of the different management structures. So, yes, we appreciate that question.
Clarification is always a good thing.
That's right. That's right. So moving on to injectable antibiotics, we do not ask questions in the swine survey as we did in the bee survey on metaphylaxis and group treatments. And the only questions that we ask about injectable antibiotics is the treatment of individual sick animals with injectable antibiotics. And the question specifically is whether the following information in question 11 was recorded for treatment with injectable antibiotics. And again, we're not asking for the actual name of the antibiotic. We're not asking for the number of injections or anything. We're just asking if they record that they treated, never, sometimes, or always, if they record the antibiotic, that an antibiotic was given, and if they record the treatment withdrawal period. And there should be one X per row in each of these tables. Okay, we'll move on into the quality assurance programs. The questions about the Pork Quality Assurance Plus certifications we have in the manual. We ask if any people who work on this site were currently PQA Plus certified. Check no if no one has been certified. So if the participant requests further information on this, you can let him or her know that it's an educational program overseen by the National Pork Board that addresses food safety, animal well-being, environmental stewardship, worker safety, public health, and community. Individuals can become certified, and sites can receive their status through an on-farm site assessment. So information on this is available at the National Pork Board site, and that's www.pork.org. And please refer them to that site for any PQA information. Question 13 then is whether the site has ever, not just in the last 6 months, had a PQA plus site assessment. And that is just a simple yes or no. On some of these, if the person does not know, rather than just leaving it blank, if you wish to write in don't know, and this really applies to any question where it's a yes or a no, and you don't have a place for a don't know, please write that in the margin. It's perfectly okay to add notes, that, especially that if you don't know, that's informative to us. Okay, question 14, then we just ask for the date of the last PQA plus site assessment. And let's see, question 15, if that, question 15, has it ever had an audit under the Common Swine Industry Audit? Apparently this is a new program since October of 2014, and they may not be aware of it. It standardizes third-party audits. It was based on the PQA Plus and the transport quality assurance programs, and information on this is also available at the www.pork.org site, the National Pork Board site, and you can refer them to that. Again, if they don't know anything about it, please put in a don't know. That would be informative, not just to us, but to the industry and the pork board, to let them know whether or not their educational materials are getting out there. We certainly want to encourage them to be informed of all of those. And then question 16 is when was the last one conducted. So then moving on to question 17. These are the things where we're looking, questions where we're looking for veterinarian visits between July 1st and December 31st. We are looking for the number of times here that each of the listed types of veterinarians visited the site. And this would be for any purpose in the 6-month period. And we have 5 different options there. We have a note to enter 0 here if they know that a type of veterinarian did not make any visits during the 6-month period. So in this case, we aren't looking for a don't know. We actually would like one of those 0 responses. 0 means 0. Okay. So moving on from that, we go into the DCPR information, and this is a question regarding the veterinarian client-patient relationship for pigs on this operation. And we note that most sites have a relationship with a veterinarian, and most of them have an established DCPR. So that, and here we also note that an operation is synonymous with the word site. In case that this site is covered by a larger operation and that the agreement or the relationship covers all of the sites within that operation. Remember that our hierarchy and algorithm getting to the site level went through a company operation. And so some of these will have DCPRs at the operation level, even though you're surveying at the site level. So a little bit more information. You probably saw this before from Tuesday if you were on that training, that the DCPR is defined by several different bodies. We have put the FDA definition in the manual, and we also have the AVMA definition there in the training, so you can review that. But also states may have their own definition within their State Practice Act. And so these DCPRs are very important because it's the basis for how veterinarians, clients, and patients interact. But not only that, these are going to be required going forward by the FDA in order to obtain antibiotics. Veterinarians do need an established producers do need an established relationship with veterinarians. They're going to need veterinarians in order to obtain medically important antibiotics for veterinary feed directives and for prescription use of water antibiotics. So the VCPR is something that will begin to be more important for those who have not had them in the past. And this is a tracking tool for us to see how the veterinarian, the DCPR relationships might change between 2016 and 2017 when these rules went into effect. And if there are notes here from producers that you wish to write in the margin about perhaps the availability of veterinary care, the practice, whether or not there are enough practices, I guess, in the region to provide the care. Those are the kind of things that might be informative that we could relay to some of our industry partners. Okay, and so what we ask in question 19 is what is the formality, I guess you might say, of the VCPR? Is it actually a written document that was signed by the veterinarian and the producer? Is it just a verbal agreement that the veterinarian serves that producer? Or is that very loose, I guess you'd say, that the veterinarian hasn't formally mentioned a VCPR, but the producer considers that there is a relationship with the operation. Again, this likely will change in 2017 as that becomes a more formal process, and some states are going to require that a VCPR be a signed document and that it is maintained as a record for a certain length of time. The best place for them to get that information may be to go to the state veterinary licensing board's webpage, the regulatory authority in the state for veterinary practice will probably have the VCPR information on it. Okay, so move on here away from the VCPR. We're looking here at the level of importance of different practices for preventing disease and reducing the need to use antibiotics. You probably note that the first item on this list is biosecurity and whether or not the site actually has a biosecurity plan for employees and visitors and others who are entering the site, and the importance of each of these factors for preventing disease. So this is a bit of a knowledge test of their level of knowledge of the importance of things like biosecurity, vaccinations, herd health visits, weaning practices at older ages, facility management adjustments such as ventilation systems and air filtering, all-in, all-out management of pigs, using alternatives to antibiotics. Many are turning to alternatives such as probiotics and prebiotics and other types of alternatives to try to reduce their need for this, and then adjusting diet. So this is interesting and important information for recording these practices. And then we have a note about in the manual that in this question that operation is synonymous with site if these practices are followed by all sites within the operation. Okay.
So we have a couple of questions. Do you want to?
Yes. Yes.
So is stewardship question number 20 just meant to gather opinions of producers?
Yes. Those are opinions. How important do they believe they are for preventing disease? Yes.
And then also for question 20 and forward, you're dealing with current time frame, not data period, correct?
Well, that's a good question. We didn't put specific dates here. Let me just think this through. I think it would be important to maintain the date period of that calendar year 2016 here. I don't think we want to shift to a 2017 opinion. We want all the data that we are requesting reflects back to the calendar year of 2016.
Okay.
Very good. Good question. Now I don't have a slide for question 21, so I'm trying to see how we, let's see, withdrawal times. We'll go over this really quickly. 21, request information on complying with withdrawal times for antibiotics to make sure that no pigs enter the marketing chain with antibiotic residues. And we have a number of different items, methods to use to comply with times, and that is written records with dates, identification of individual pigs, urine samples tested, serum samples tested. They do not administer antibiotics for a predetermined period, or no specific steps are taken to comply with that. And just checking all of those that apply on this would be useful. And again, question 22, we're looking for the role of the person who answered most or all of the questions in section B on stewardship. Okay. That brings us to the end of the questionnaire. I do want to throw out another note of thanks to all of you who have hung in here with us going through this training. I know it can seem tedious, but I do want to reiterate that this information is extremely important to us in VS, and it's important to practitioners and to producer groups and all of our stakeholders, because antimicrobial use is a really important topic right now for animal agriculture, and we need this information to inform the folks going forward in this environment. I'm going to just see, we have some information here, further information on where you can get information on the USDA Antimicrobial Resistance Action Plan. It's available online. You can look at the goals and objectives and how these things apply to the work that we're doing. Again, the FDA CDM is a regulatory site. They have volumes of information on antimicrobial use, and they have all of their guidances that describe the evolution and the changes that have been occurring in their regulations over time. And I highly recommend, if you have questions, that you go there and read it. It can be very dense reading, but it's still worth your time. We have a site where we have the 6C data for confidentiality of the data that you're collecting, and that's there's a PDF there that explains the guidelines on this and how we protect the data. And then we also have the our NAHMS site, where you can see any of the products that we have come out with on earlier studies, information on antimicrobial resistance studies going forward. And so our pitch for going forward is here. On the horizon, we have received funding to begin planning for longitudinal studies, and these are studies that are repeated in a cohort of farms or sites where we would revisit the farm or the site every 3 to 4 months for 3 to 5 years and collect data, the survey data similar to what we're collecting here, but probably more record-based and actual dates and so forth of treatments. And so then we'd also collect samples of pathogens. They will probably be foodborne pathogens, and we are looking at animal health pathogens as well. All of that data will be collected confidentially and protected. We will likely do visits by our VS field staff for the surveys, and possibly by others for samples. If you listen closely to Bill's talk, you understand that we cannot see animals, and so 60 data or 60 protection is going to be a little more challenging with this study. And we expect to be enrolling farms and sites by early 2018. This is not a pitch to ask you to enroll anyone, but if you are in a, if you do have producers, farmers, ranchers, whoever that you think would be interested in the study, please keep that in mind. And as we roll this out and we start talking with people about how to find these people who could commit to us for 3 to 5 years, we will probably be back in touch with you, just to and maybe as a focus group, to find out who you could, who you might recommend and what type of kind of incentives the producers might be interested in. So again, I really want to express our sincere thanks to all of you for participating in this study, for working with producers, for taking the time to work with them and answer their questions in detail. And as much information as we thought we could provide in the manual, if you don't find something in there that a producer has questions about, please refer, let us know, and we'll try and get you the information. Again, thanks for your time these past couple days, and for getting out in the field and for getting this done. We really, truly appreciate it. We know that the next 6 or 8 weeks is going to be intense for some of you, very intense for some of you. And on hot summer days, we do appreciate you being out there. Okay, I'll quit talking now, and we'll hand it over to Addie or our moderator going forward.
All right.
I don't.
Go ahead, Abby.
I don't really have anything. I'll be sending an email to the coordinators that will have some bullet points on it to just clarify a couple of things, but they don't need to be recorded on this webinar.
All right. Thank you for joining today's conference. The session is now concluded, and you may disconnect.